Hey guys, welcome to eZeLiving.com. You're watching The Checkup. Once again, I'm joined here with Ali, our in-house eZeHealth expert and fellow of the European Society of Cardiology. Ali, thanks for joining us again.
Thank you for having me.
Okay, so today we're going to talk about heart attacks. Heart attack is a very, very scary health condition, and it is very actually common in today's world.
Yes.
So more basically, Ali, what is a heart attack?
Okay, a heart attack is basically a complication of what we talked about last time, cardiovascular disease. So when you have a blood vessel, a coronary artery, and this coronary artery supplies the heart, which is a muscle. And for a muscle to function, it needs proper blood supply. So when this artery is plugged or clogged with time, the muscle is going to start to die. And then you have the signs and symptoms of having a heart attack.
Okay, yeah. All right. And I know it's very scary because a heart attack can really come out of nowhere, right?
Exactly.
How do you recognize that somebody is having a heart attack, first of all?
Excellent question. Well, there are very common signs and symptoms. One, chest discomfort. And usually they present with chest discomfort that is like squeezing. It's like they tell you that I feel like someone is sitting on my chest. Squeezing chest discomfort that radiates to the left arm, to the jaw, to the neck, and sometimes to the back, sometimes to the abdomen. So chest discomfort, nausea, vomiting, sweating, etc. And some of them also present with shortness of breath.
Okay, so a heart attack can last a long time. I mean, what kind of time period are you looking at here?
Sometimes patient presents for pain that comes for seconds up to minutes and then is alleviated and then comes back again. And sometimes patients have progressive pain for minutes and maybe to develop into hours. Yeah. So it actually differs.
All right, and if you come across somebody that is having a heart attack, what can you do to help that person?
Okay, this is a very important question, and please, I want you all to listen carefully. If you're suspecting a patient is having a heart attack, what you should do is, the first thing you should do is activate the emergency response system or call 999 to get an ambulance immediately. Number one. Number two, as you said, it's a very stressful situation. Anyone having these signs and symptoms are going to be under so much stress thinking that they're going to have a heart attack. Mm-hmm. So what you need to do is you need to call them as calm as possible. So this is number two. Number three, immediately give the patient a dose of aspirin, which is
any aspirin?
It's any aspirin. It's 160 to 325 milligrams of aspirin.
Okay, and for those of us that aren't in the health field, how would we know the dosage?
Usually what you buy from a pharmacy is something that we call baby aspirin, and this is usually between 75 and 80 milligram per tablet. Mm-hmm. So you need at least 2 of those tablets. As we said, keep the patient as calm as possible and immediately transport the patient to the nearest hospital.
Okay, all right. Well, that was very informative, Ali. Thank you for informing us on the effects and the signs of a heart attack.
And just one more thing, not all patients who have a heart attack develop signs and symptoms. And so, like patients who are diabetic mm-hmm. for a long time, females are actually more commonly, they don't present with the typical symptoms. So any one of these signs and symptoms, you immediately should suspect a myocardial infarction or a heart attack.
And immediately get them medical attention.
Yes.
All right, everybody. Well, those are the effects, the signs, and how to help somebody out who is having a heart attack. Ali, thank you for joining us.
Thank you for having me.
All right, you've been watching The Checkup here on eZeLiving.com, where you can find anything and everything lifestyle.